Parents often have a lot of questions about toilet training. In fact, toilet training can be a very simple process if done appropriately. First of all, the question is, when do you start toilet training? A lot of people like to start very early. We usually recommend that you don't start until after 3 years of age. But every kid is different, so you want to look and see that they've reached certain milestones, that they're ready to toilet train. Are they able to communicate with you that they need to go to the bathroom? Can they feel that they need to go to the bathroom? Are they upset about being in a dirty diaper? And can they dress and undress themselves appropriately? If they've reached all these milestones, then you probably can begin toilet training. The first step is to sit them on a toilet every few hours during the day to allow them to empty their bladder, and also to sit them on a toilet after breakfast and dinner to try to empty their bowels. Eventually, the child will learn the schedule and learn to empty their bladder regularly. The key is not to force issues. The child will be out of diapers eventually, and you need to just take your time. The big problem we see in children is that once they're toilet trained, the parents leave them alone, assuming that they'll empty their bladder and bowels when they need to. Kids never do this. They want to play, they want to watch TV. The last thing they want to do is go to the bathroom. So what you need to do is make sure that they're emptying their bowels and their bladder regularly. I would recommend placing the child on the toilet every few hours still to make sure they try to empty. And never lose track of when your child's going to the bathroom, because that's when problems happen. When children hold for extended periods of time, they develop other issues. All of a sudden they develop wetting issues, constipation, infections, and these are all due to delayed emptying of the bowel and bladder. This is what we call dysfunctional elimination. Here at Brenner's Children's Hospital, we have a team of doctors dedicated to treating dysfunctional elimination, including urologists, gastroenterologists, physical therapists, and psychologists. This team is using the latest techniques to improve children's voiding and make sure they don't develop health problems from these issues. For more information, please visit brennerchildrens.org.